But now when you give, if you give in high potency, don't repeat it often. If you give in low potency, repeat it, but to a lesser scale. A homeopath has to be more patient than the patient. So if you lose your patience, you're actually spoiling the case. नमस्कार, अस्सलाम वालेकुम, सत श्री अकाल, वणक्कम। डायनामिक टॉक्स की सीरीज हमारी श्रृंखला चालू है और मैं हूं जद्दा और मेरे साथ है डॉक्टर मोहम्मद ज़ाहिर। ही इज़ फ्रॉम जद्दा एंड डॉक्टर मोहम्मद, प्लीज इंट्रोड्यूस योरसेल्फ।
Assalamu alaikum. I'm Mohammed Zahir, Associate Professor of Physiology in King Abdulaziz University. I came across homeopathy probably like 5-6 years ago. First was introduced due to sport injuries. I got multiple sport injuries and it healed.
So let me tell you that he is a grade 1 kickboxer. He is an excellent kickboxing. Yeah?
Yes, sir.
And only kickboxing?
Muay Thai and Jiu-Jitsu.
Yeah. So because of that, he has sustained many injuries and that has brought him to homeopathy.
Yes, exactly.
Okay. So what is your question?
My question about the use of aconite. Now, I use it with my kids, but I have a question regarding the best usage of it. So when my kids getting in very early stage of their sickness, they usually get irritable, they get some misbehaving, and I catch that this is not their normal. So my question is, should I wait until something show up? Is it like fever is coming up into them? Is it like coughing or sneezing or cold? Or should I start aconite immediately regardless what's coming up?
Okay. So ideally, any homeopathic medicine should be used only to help the diseased vital force regain its original vitality. Okay. It is not like other system of medicine where we give a drug and the drug does its job. In homeopathy, we are just boosting the disease vital force and making it free from the disease, what we call as miasm. Okay. Now, any drug, you are talking about aconite, but I am talking any drug. So, first and foremost principle of any physician should be give a chance for the body to understand the disease and react on its own. If it needs help, only then give. How do you know that it needs help? It will show in a form of symptomatology. Certain symptoms, certain eruptions, certain eliminations are good for the body. Like if a person has some food, passes loose motions, so that means it has not suited it. It was food poisoning. Yeah. The body has flushed its toxin, so you don't need to give. Although arsenic is a drug for food poisoning, but you don't need to give. Unless the patient is collapsed. Then arsenic may help or veratramal may help. Same way with aconite. Aconite is a very, very important medicine. In fact, the most important medicine in acute condition. But that does not mean that it should be given in starting of every acute condition so that we abort. See, many viral fevers, so so-called viral fevers, so-called allergies, so-called sneezings and cough are important because these are the body's reacts. Like if we sneeze, if we cough, so the body is actually overall, it's trying to react to the so-called stimuli. Let it react, let it happen. And even if till your children can bear the upper respiratory tract infection or the headache or the fever, do not touch them. Either with aconite or any other drug. Day 1, day 2, day 3 does not matter. Do not touch them. You can give them warm water to drink. You can give them rest. We underestimate rest. हम लोग rest को बहुत जल्दी underestimate करते हैं. We don't believe in rest. And if the body is sick, let it take rest. No, what's the problem? Instead of giving medicines, homeopathy, allopathy, whatever pathy, rest is better. And घरेलू household remedies, warm water, tulsi, basil leaves, or turmeric. All these are helpful. Or in some abdominal complaints, less food. You stop food. Fasting is a very, very good medicine. So first and foremost, let the body take its own control. Do not start. And unless and until you have a full picture of a particular drug, Do not start with any drug, be it aconite, arsenic, sulfur, irrespective of the name. Wait and watch. So that is the finest method and the wisest method a homeopath should approach any case. Even myocardial infarction, even angina I am talking about, wait. Do not directly just give the drugs. Nothing is going to happen. It takes own course. Till you are clear about the picture, don't spoil the process. Let it heal. It will take. Once you are clear about the process that this is aconite picture, or for that matter camphor picture, or that matter, for that matter, any drug picture, then safely give. But now when you give, if you give in high potency, don't repeat it often. If you give in low potency, repeat it, but to a lesser scale. A homeopath has to be more patient than the patients. So if you lose your patience, you are actually spoiling the case. So ladies and gentlemen, ऐसे बहुत सारे वेरी इंटरेस्टिंग क्वेश्चन, सो वैसे बहुत सारे क्वेश्चंस आएंगे आगे भी, देखते रहिए. तब तक के लिए हमको इजाज़त दीजिए. थैंक यू वेरी मच.
Thank you, Dr. Aadil. That was perfect answer. Thank you so much.